Chiara and Alison spend most Fridays at this community centre in Dalry.
Make sure you've got the blockers out.
The group gets together to relax, socialise and enjoy some friendly rivalry.
You know!
What do you enjoy the most about coming along to these classes?
Meeting everybody and meeting new friends.
Sounds like a good bit here.
Too good.
Sorry, Alan, mate.
But it's much more than a social event. For adults at risk of isolation, it's a lifeline.
It's really important. Most of our members have learning disabilities, quite mild learning disabilities, so they don't qualify for that formal support. Our organisation kind of pick up those people who fall through the gaps.
That's a good one.
Neighbourhood Networks supports around 300 adults across the Central Belt, from here in North Ayrshire through to East Lothian.
Without us there, some of them would really struggle to get on with life, and they might become one of those kind of statistics that are forgotten. So our service is really important for those who don't have anybody else to be there for them and help them get out and build that confidence and connect with new groups within their communities that they can then go on to themselves.
So you put your wee one up here and then your 4 goes down here.
Michelle has worked with the group for 5 years and says its impact is clear to see.
Some of our members have been here for that long. Other members have just kind of recently joined within the kind of last 6 months to a year. And it's good to see those kind of friendships grow. So the ones that have been here for a long time are a lot more confident, but they kind of seem to support the ones that are new to the group, and they all kind of welcome each other within the networks as well, which is lovely to see. There's some real good friendships blossoming.
Do you want to pick a wee ticket as well, Jane?
It's 20.
Anyone at all, and then you're going to look for a price on it and see how much it costs you to travel there.
So Chiara, tell me about what you've been doing here today. What have you been planning for?
Doing the budgeting on what you want to travel and how much your money is.
Today, Michelle is helping members develop money management skills by preparing for a mock day out.
Simple things as they're now able to go to the shop and manage their own money for kind of day-to-day shopping. Some of them are working on bigger budgets as well, and some of them are moving into their own accommodations, so that's even kind of bigger budgets again, and kind of bills and things that they need to learn to be able to manage themselves.
75-70, yes, you were right, Alison.
Alison recently put what she's learned to good use on a trip abroad.
I take one of the budget Paris, so I had to do that. I learned how to be more confident, out and about more, or with cooking and doing other things.
Alison's been coming along for a few years and now organises her own events with other members.
Some of the people are quite hard to recognise from when they first began with the networks. When she first started, the network was one of those kind of quiet person, sit back, wouldn't get involved as often, and now she has the members coming round to her house without community living worker support, and they hold their own cooking class, so they'll all cook dinner and things like that, and take it away home with them to have lunch the next day.
The service offered by Neighbourhood Networks is just one example of social care in action within our communities. Chief Executive Heather Calvo says often that work goes unnoticed.
People might think sort of traditionally social care is going to people's houses, very practical support and helping with meal preparation, maybe personal care. But social care is also helping people emotionally, helping people get out and about, helping people develop skills, helping people be present and be able to contribute to their communities.
She says that work has a huge knock-on effect.
Without social care, the challenges that the NHS are currently experiencing would be far worse. Social care is an investment. It prevents people from ending up in hospital in the first place, or maybe surrounded with networks of people that are not positive, that might take a loan of them or try to take money off them.
If your organisation wasn't here, what support would there be available? Where may people find themselves?
I think in absolute crisis, certainly leading very lonely and isolated lives, and not having that chance for their potential to be tapped into and developed. But quite often the people we work with don't really leave their homes. Their circle is very small. It's pretty desperate actually, without social care and organisations like us. For people, it's a very lonely existence.
The UK government recently announced plans to end any more overseas recruitment of care workers. And in April, there was a 1.2 percentage point increase to employers' national insurance contributions.
And we will reduce the secondary threshold, the level at which employers start paying national insurance on each employee's salary, from £9,100 a year to £5,000.
Heather says that will see the charity's outgoings massively increase.
Our national insurance bill is going up by 35%. Now, given that most of our costs are staff, that's enormous. When I heard the news about the budget last October, my jaw hit the ground and my heart sank. Not just for us, but for social care organisations across the piece. And one thing that kind of really got to me, that it was couched in this kind of reference to people, organisations or people with the biggest shoulders and the deepest pockets need to take their share of the load. Now, in charities, we don't have deep pockets at all.
The full impact of those changes remains to be seen, but Heather says the outlook isn't good.
We are members of a membership group called CCPS that accounts for a lot of social care organisations across Scotland. They did a survey and the statistics are stark. 57% of organisations may need to hand back contracts to local authorities because they can't afford to deliver it. The bill across 50 organisations is something like £30 million we have to find from somewhere. 67% of organisations might need to tap into their emergency funds this year just to get through the year. And the worst of all is 91% of organisations have said that without significant change, they might not be in business in 4 years' time.
What state will we be in if those 91% don't make it through the next 4 years?
I think it's grim. I think this is a matter of what you want to see in your community, in your society. And for me, I think it's the just sheer waste, it's the untapped potential that will be lost. And all the people that are going to get into crisis. The impact on the NHS will be huge. The impact on emergency services like the police are already struggling with sort of crisis and people in crisis and communities and having to respond to this. What's going to happen to the police? All this knock-on effect. So that's why I said at the beginning, social care is something that benefits everybody, because everybody needs those emergency services, don't they? And they'll be even more stretched without social care.
Michelle says it's disheartening to think more people may become cut off from their communities.
A lot of our members get involved in volunteering opportunities. Before, they probably didn't know what was going on in the community, but just through coming out with us, finding out what's on, going along to groups, us taking that step back and letting that become their thing, and they can go independently, and then now volunteer at the kind of community gardens and churches, which is really good because they are now feeling a sense of purpose and they're able to give back to their own community.
The future of social care looks uncertain, but the confidence and skills the members have gained here will stand them in good stead for whatever comes next.